Good afternoon. So welcome to Thursday Reading Live. This is me Vandana joining you from Needhu's Academy. Okay, so do you have any doubts regarding doing part B, or do you have any idea how to do part B? Okay, so without losing the time, let's jump into a sample question from part B. Then we will discuss about part B. So I'll give you 2 minutes to do the question. So here is the question. Okay, so coming back to this question. Okay, so got the correct answer? Okay, I'll read the question first, then we will move on to the answer. So the question is, the memo reminds parents not to. Okay, so this is all about not to do something. Parents not to. Okay, so in which category the question falls under? So when you do part B, it's important we have some steps to doing this particular question. Okay, so first of all, read the question. That is the first step. So what is the second step? Underline the keywords from the question. So my keyword from the question is parents, then not to. So these are only keywords from the question. Then the third step, understand the question. So what is the question? In which category the question falls under? Okay, so I can say this question falls under the third category, which is memo. Okay, as you can see here, there is a sender and receiver. So this is a memo. And what are you reading for in a memo? Okay, so we are reading for to understand the purpose. Understood? Okay, so first of all, read the question, underline the keywords from the question, understand the question, then read the options. Okay, so when you read the question, always connect with your options. It will help you to understand the option or your answer better. So parents not to do something we have no idea. So not to purchase the medicines from a local retailer, then not to keep calibrated measuring spoons, and not to exclude appropriate information on the box. So what is the next step? Underline the keywords from each of the options. Okay, so either you can read the question first, then the options, and then you can move to the paragraph, or you can read the question, then the paragraph and the options. Okay, it's up to you. So from option A, my keywords are purchase, then medicines, retailer. Okay, from option B, keep measuring. Okay, these are only keywords from option B. And from option C, I am marking exclude, appropriate, information. So these three are the keywords from option C. Then I am moving to this particular paragraph. Okay, so before that, a lot of correct answers here. Okay, I'm so happy to see that. Okay, Reba, Vidya, Kochus, yes, good afternoon, Reshma. Okay, so what is the paragraph is all about? This is a memo, medication administration policy. Okay, so what is it? To parents or guardians from the city of Hampton School, all prescription medication or special medication purchased over the counter must have state DHS medical consent best practice form. See, okay, so all the medication which they are purchasing should have or must have state DHS medical consent best practice form completed and signed by a physician and parent or guardian. See, so is it avoidable parents not to purchase the medicines? No, they have to do it, right? So this is contradictory option or opposite option. So from the first line itself, we are eliminating option A because it is not the correct answer, okay, which is contradictory option, or I can say opposite option. Then I am reading the rest of the lines. All medications must be in original package or container with a pharmacy label to include child's name, name of medication, dosage, time the medication must be taken, and the doctor's name. So everything should be included in the box. See, on the package, on the box, which means on the package. So you can include everything. All medications must be in original package or container with the pharmacy label to include. It should include everything. Okay, so what about option C? Is it include? No, it is excluding. So maybe option C, not to exclude, parents not to exclude appropriate information on the box. Let's see, what is it? Then, all equipment necessary to accurately administer medication must accompany medication. Medication requiring refrigeration will not be accepted based on Virginia state laws. Violators are subject to fines. Okay, so which is the correct answer here? Any idea? Is it option A? Already we have eliminated option A. So we have doubt regarding B and C, whether it is B or C. Parents not to keep calibrated measuring spoons or not to exclude appropriate information on the box. Is that which one is the correct answer here? Why it is option C? A lot of correct answers. I mean option C answers here. Reshma, Anu, Jeena, okay, Jessica, Ansu, Kochus, okay. Okay, Agal, I'm so happy to hear that. Okay, you got 350 for reading. Okay, congratulations, dear. Okay, so anyway, so what is the correct answer here? Any idea? How you guys are eliminating? If your answer is option B, how you eliminated it? Or if it is your answer is option C, then how you eliminated option C? May I know how you guys eliminated option B? If your answer is option C, then how it is eliminated? Option B is not given, right? Okay, so let me check the paragraph once again. Options for option B. All medication must be in original package or container with a pharmacy label to include child's name, name of medication, dosage, time, and the medication must be taken, and the doctor's name. All equipment necessary to accurately administer medication. So what do you mean by equipment? Okay, what equipment is mentioned here? So this measuring spoons can be connected with an equipment, right? This is an equipment. So all equipment necessary to accurately administer. So you have to use this equipment. So we can't avoid that, right? So I'm eliminating option B. It is not the correct answer. I'm so sorry. Okay, so the correct answer is option C, which is not to exclude. So, which means don't avoid. You have to include appropriate information on the box. So, I'm eliminating option B because it is contradictory or again opposite option. It is not mentioned. We can't say like that because it is mentioned in the form of equipment. Okay, so we can't say it is not mentioned. It is mentioned here, but it is contradictory option or opposite option. Okay, so the correct answer is option C, exclude appropriate information on the box. Okay, and I'm so happy. A lot of correct answers here. Okay, Archana, Reba, okay, Fia, Kochus, Ansu, Jessica, Jeena, Anu, Reshma, Reba, Okay, a lot of correct answers. Yes. Then, what about the timing? What about the timing? How many minutes or how much time you will take to complete part B? Okay, so to complete part B, almost we need maximum of 12 minutes. Okay, if you guys are doing part B additional materials regularly, then you can do part B within 10 minutes. Trust me. Okay, so for doing part B, we need to take almost 10 to 12 minutes. And we have total 6 number of questions. Okay, and what type of question? I can say what? Multiple choice questions with 3 answer options. And there will be a respected paragraph. Okay, so as I mentioned earlier, you can either read the question first, then options and the paragraph. Or you can read the question, paragraph and the options. So the strategy which we are doing here, which is called elimination strategy. Okay, and I've shown you what is elimination strategy through this particular sample question. I hope it is clear for you. So now let's move to part A. Okay, yes. Okay, Riba and Vidya, yes, 12 minutes guys, very good, yes. Okay, hi Sarala, good afternoon dear. Okay, so now it's time for doing part A. And we have a new topic here, which is, okay. And I hope you guys will have done the material. So the topic it is all about interstitial cystitis. Okay, interstitial cystitis, and that is the topic. And here is the topic. So now let's look into how to complete part A within 8 minutes. Okay, if you guys are beginners, okay, it's not possible. I'm saying that it is not possible for you to complete part A within 8 minutes in the first attempt, for sure. Why? Because, yeah, of course, you guys are beginners. Through complete, complete dedication and practice, it will be, you can do the material or you can complete the material within 8 minutes, only through continuous practice. Okay, so please do additional materials if you want to finish part A within 8 minutes. Then now let's look into the strategy, the time, the questions, everything in detail. Okay, yes. Okay, so here is the material, interstitial cystitis. So we have 4 different texts in part A, that is text A, text B, text C and text D. Okay. Okay, so may I know, I just want to know how much you know about part A. So let me please know in the comments, what do you know about part A? Okay, I'm starting with time. So may I know in the comments how many minutes it will take to complete part A? Okay, may I know in the comments about the time? Hi Soumya, good afternoon dear. Okay, Nimisha, Tessie, Sarah, good afternoon guys. Okay, so how much minute? Okay, Riba, Reshma, it is 15 minutes. Okay, so that's all about the time. Okay, Vidya, 15 minutes. My second question, how many questions? Within 15 minutes, how many questions? Okay, Nimisha, it's not 12 minutes, dear. It's all about 15 minutes. Okay. Yeah, through practice, you can finish it within 8 to 12 minutes. Yeah. Okay. Very good, Sarah. Yes, Tessie, Reshma, it is 15 minutes. Yeah. Then what about the number of questions? How many questions? Within 15 minutes, we have to complete 20 questions. Okay. Very good. Okay, Reba. Sarah, it's not 24 dear. It's 20 questions. Okay, not 24, 20 questions. Okay, Nimisha, Tessie, 20. Okay, Vidya, 20 questions. Excellent. So the third question is, what strategy or what method we are using here to complete part A? An idea? What method we are using or what strategy we are using to complete part A? What strategy? Okay, so what strategy you are using? What method? Is there any easy method to complete part A? Okay, Sarah, skimming. Okay, Reshma, skimming and scanning. Okay, Tessie, skimming and scanning. Okay, Sarah, scanning. Vidya, okay, Reba, skimming and scanning. Okay, any other methods? So do you know any other methods? No, right. Okay, skimming and scanning. Okay, Nimisha, Gina, skimming and scanning. So my next question, what is skimming? Okay, what is skimming? Skimming and scanning, yes, that is the method, I agree. So my question is, what is skimming? Okay, Kochus, skimming, which means fast reading, whereas scanning, which means searching for important words. Excellent, okay? Yes. Okay, Libby, Peter, skimming and scanning. Okay, Vidya? Yes, fast reading. Okay? Yes, Reba, Tessie. So, skimming, which means fast reading or speed reading. Okay, so if you know the language, yeah, it is very easy to read whatever you want. You can read it very fastly. So, that is skimming. Okay, so my next question, if you are skimming through each of the text, so we have 4 texts. If you are skimming through each of the text, is it possible for you to answer this 20 questions within 15 minutes? Is it possible? Of course not. So what about the next one, scanning? So what is scanning? What is scanning? Okay, Gina, skimming, which means fast reading. Okay, so what is scanning? Yeah, what is scanning? Scanning, which means we are searching for some important words from each of the text. Okay, so skimming is not enough. We have to do along with scanning. So skimming and scanning, and that is called the strategy. Okay, so when you skim and scan, what are the important words or what are the important things that you have to take care of? Okay, so what are the important words or what are the key words? Okay, it's very important to yes, Sinath, very good. It's important to underline the keywords, of course, dear. So what are the keywords that you will underline when you skim and scan? Okay, Libby, important keywords, of course. Okay, Riba, headings and subheadings, very good. Then numbers, symbols, okay, signs and symbols, okay, not just symbols, signs and symbols. Okay, short form, okay, Sarah, very good, short forms. Then anything else? Hyphenated words, okay, I agree. Okay, Tessie, heading, subheading, numbers, brackets, very good. Okay, Riba, heading, subheading and heading and subheading, okay, Sarah. Okay, so we have actually 13 keywords. Okay, we have a proper order to underline the keywords. So the first one is heading. Okay, second one, subheadings. Third one, numbers, all the numbers. Fourth one, what is the fourth one? Signs and symbols. Fifth one, all the names. So whatever names mentioned, you can mark all the names. Sixth one, okay, what is the sixth one? Abbreviations, which means short forms. Seventh one, all the italicized or bold words. Eighth one, brackets. Ninth one, all the words that indicate time. 10th one, all the words which are related to experiment. Then 11th one, all the words which can be connected with research. 12th one, the words, I'm not marking you to do this. I'm not saying that. You have to mark this. Okay, just give special focus to all the first and last line of each and every paragraph as well as all the bullet points. Okay, so these are the 13 important keywords that you can mark when you skim and scan. Understood? I hope it is clear. Okay, so if you guys are by hearting this technique, it will be easy for you to clear part A within 15 minutes and for sure you can score 20 out of 20. Okay, so now we are just moving to the material. Okay, so interstitial cystitis. Interstitial cystitis or bladder pain syndrome is a condition that causes long-term pain or discomfort in your bladder and abdominal area along with urinary frequency and urgency. Healthcare providers don't know what exactly causes it. But causes may include autoimmune diseases, allergies and issues with your bladder lining. So my keywords from the first paragraph, which are the condition. Okay. Then long term, which indicates time, long term. Then I'm marking abdominal area or bladder. Then urinary. Then healthcare providers. Okay, autoimmune, allergies, again bladder. So these are my keywords from the first para. Then I am moving to the rest of the lines. Anyone can get IC or BPS, so the abbreviations. However, you may be at greater risk if you are a woman or a person assigned female birth, AFAB, then are 30 or older, have another condition that causes chronic pain. Then interstitial cystitis bladder pain syndrome is common. It affects approximately 1 to 4 million men and people assigned male birth, AMAB, then 3 to 8 million women and people, AAFAB, in the United States. So these are my keywords from text A. Okay, so what about you guys? What are your keywords from text A? May I know in the comments? What are your keywords? Okay, Ansuya, yes. Hi dear, good afternoon. Okay, so may I know what are your keywords from text A? Okay, so now let's move to text B. So likewise, you can read it and underline the important words. Okay, according to the 13 strategy, keyword strategy. Okay, so text B, it's all about urine analysis or urine tests. Okay, long term. Okay, Sarah. Then what else? So what about text B? What about text B? You can read the text and tell me what are the keywords from text B. Okay. So urine analysis or urine test, you will provide a pee sample for your provider. So I'm marking provider. They will examine your sample with a microscope and look for blood in your pee and signs of an infection such as organisms, germs, pus or white blood cells. Okay, your provider will prescribe antibiotics to treat any infections. If your pee is sterile weeks or months after treatment and your symptoms remain, okay, your provider may diagnose interstitial cystitis, bladder pain syndrome, then biopsy. Okay, so anesthesia I'm marking, as well as needle, okay, tissue, and yes, bladder. What about the next one? Another test, it is cystoscopy. Again, provider, cystoscope, the name of this particular thing. Okay, so these are my keywords from text B. And I'm just moving to, as well as one thing I missed. Okay, during as well as procedure, which is time and the word which can be related with experiment. Okay. Then text C, it's all about a chart. So we have pictorials in text C and text D. Okay, there are a lot of numbers mentioned as well as abbreviations mentioned here. I'm just marking everything by skimming and scanning. Okay. Yes. So these are my keywords from text C. And from text D, again, it's all about a table which contains oral medications for the treatment of IC or BPS. Again, a lot of medicines mentioned here, abbreviations. Okay, so these are my keywords. All the numbers I'm marking. Okay, so these are my keywords from this. So now we are moving to the first question. So 1 to 7 set of questions. Already you guys know we have total 20 questions. And 1 to 7 set of questions which can be called match the following. Then 8 to 14, those are called what? Short answer questions. And okay. Yeah, 1 to 7, match the following. Then 8 to 14, that can be called short answer. And okay, 15 to 20, it's fill in the blanks. Oh, lot of keywords. Okay, I'm starting with REBA. Okay, urine test, then antibiotics, white blood cells, bladder, hematuria. Okay, urine analysis, biopsy, anesthesia, bladder cancer. Okay, Sarah, urine test, pee sample, provider. Okay, anesthesia. Okay, Kochus, urine analysis. Yeah, almost the same. Okay, Vidya, urine test, biopsy, cystoscopy, cystoscope, light tube, anesthesia. Very good. Okay, so these are the keywords. All right. So now tell me, what about the first question? Okay, match the following, which means you can read the question, do the same thing, underline the keywords from the question and tell me which texts, whether it is A, B, C or D. Typical rationales to evict some of the patients from the study group. So my keywords, okay, rationales which means the reasons, then evict, study group. So these are my keywords from the first question. So what is your answer? Typical rationales, which means the reasons to evict, avoid some of the patients from the study group. What about the correct answer? Any idea? Okay, Tessie. Okay, Reshma, Anasuya, it is C. Very good. Okay, Ammo, it is from C. So that answer should be C. And where is it mentioned in text C? Typical rationales, reasons, important reasons to avoid some of the patients from the study group. So that is from text C. As you can see here, avoiding something which is mentioned here, patients excluded from the study group because of these reasons. Clear? So that is from C. Very good. Okay, 𝐶𝑛𝐻, maybe it is text C. Very good. Then second one. What about second one? The affairs which claims the patient to have anesthesia. So my keywords, this affairs, then claims which demands anesthesia. So what about that one? The components or the factors, the incidences demands a patient to have anesthesia. Where is it mentioned about anesthesia? Okay, Tessie, Reshma, Vidya, Ammu, Reba, Anasuya, it is text B. Very good. So that is from text B. It is mentioned in text B, second and third para. Okay, which is mentioned in biopsy as well as cystoscopy. The word anesthesia, when you can provide anesthesia. So, answer which is from text B. Okay. Then the third one, divergent components that can be a cause of interstitial cystitis. So my keywords, divergent, which means different components, factors, then cause. So what are the different factors that can affect interstitial cystitis? Any idea? Divergent compounds? Okay. Okay, Gopika. Okay, Radin, Reba, Tessie. So answer is from text A. Very good. So third one, which is from text A. So my keywords, different components or factors that can cause. Okay. So that is from text A. So what are the factors? What are the factors? Okay, so that is from first paragraph. So what are the factors mentioned here? Because of a lot of factors. Okay, interstitial cystitis is a condition that causes long-term pain or discomfort in your bladder, abdominal area, along with urinary frequency and urgency. So because of allergies, diseases, issues with your bladder lining, it can cause. So answer is from text A. Excellent. Okay, Ammu, Radin, Gina, Praise, Reba, Reshma. Okay, Sarala, answer is okay. Reba, 𝐶𝑛𝐻, very good. Vidya, okay, answer is text A. Then fourth one, the only endorsed prescription to treat interstitial cystitis. So my keywords, endorsed prescription. Okay, the medicine then treats. Okay, so endorsed, I can say what? Endorsed, which means approved medicine, government approved. Okay, that is endorsed, approved medicine. So which is the endorsed prescription to treat interstitial cystitis. And where they've mentioned about the medicines? Okay, of course from text D. So what is the approved medicine here? See, FDA approved is mentioned here. So which is the approved medicine? It is of, yes. So which is that medicine? It is PPS. Okay, answer is from text D. So that answer is D. Oh my god, a lot of answers. I thought it was a bit tough questions, but you guys got the correct answer. Okay, Anu, Gopika, Reba, Sara, Varsha, Sara, okay. Okay, very good. Answer is D. Then fifth one. Which are the general convolutions of pentosan polysulfate solution? It's not solution, actually it is sodium. Okay. Yeah, so my keywords, general convolutions. Convolutions, which means side effects of a medicine. Okay. So that is convolutions of this particular medicine. Okay. So where is it mentioned? Again, without even looking into the text, we can mark it as D. Okay, so the previous question, yes, of course D. It is interrelated. So sixth one, who are more easily exposed of interstitial cystitis? So exposed, then easily. Okay, so what is the correct answer here? It is from text A. If you are a woman or a person assigned with female at birth, AFB, if it is 30 years, if you are 30 years or older, have another condition that causes chronic pain, then there is a chance for getting this particular disease. So that is from text A. Okay, Tessie. Okay, Vidya, Reba, Anu. Okay, Sarah. Yes, Reshma. It is text A. Okay, Sarala, it is from text A. Very good. Then seventh one. How many patients got included for downstream analysis? Okay, so my keywords. Patients then included, analysis. Okay, so what is the correct answer here? Patients included. So inclusion and exclusion of patients and the study group which is mentioned in text C. So answer should be C. Yeah, sorry. Okay, so coming back to the next set of questions, which are short answer questions. Okay. So the first one, ingestion of which drug instigates the problem of dry mouth? Any idea? Ingestion. Okay, which means intake, having the medicine. So my keywords, ingestion, instigates, then dry mouth. So what is your answer? May I know? Okay, Ammu, you got 7 out of 7. Excellent. Then anyone else with 7 out of 7? For the first 1 to 7 set of questions? Okay. Only Ammu got 7 out of 7? Okay. Yeah, okay. So now moving to 8th question. Okay, Riba, very good dear. 7 out of 7. Okay. Okay, Reshma. Okay. Yes, Riba, 7 out of 7. Okay, Sarah, 7 out of 7. Very good. Okay. So now, ingestion of which drug instigates? So ingestion, which means, as I already mentioned, it is intake. Then instigates, which means you, what can I say? Induces. Okay, bring about the problem of dry mouth. So which medicine is bringing this dry mouth complication? Okay, so medicine, it is mentioned in text D, and the medicine is hydroxyzine. Okay, see, dry mouth complication. So that medicine is hydroxyzine from text D. Okay, very good. Okay, Sarala, you got the correct answer. It is hydroxyzine. Very good, dear. What about others? Is that the correct answer, hydroxyzine? Yes. Then what about 9th one? The instrument which is thin and lighted used to examine inside of the bladder to rule out bladder cancer. Okay, to rule out bladder cancer. Which instrument? Which instrument we are using? Okay, Ratin, it is hydroxyzine. Okay, Reshma, very good. Cystoscope should be the correct answer. Okay, so when you do cystoscopy, we are using this particular instrument called cystoscope. Okay, a thin lighted tube with an eyepiece on the one end. So answer is cystoscope. Okay, then 10th one. The minimum age required by the people to be a candidate of interstitial cystitis. So what is the minimum age? Okay, minimum age required. Oh, a lot of correct answers. Oh my god. Okay, Sarala, Anasuya, Sarah, Gina. Okay, cystoscope. Excellent. Okay, Tessie, 30 years. Okay, so minimum age, that is 30. So where is it mentioned? It is mentioned here. See, you can't write, 30 years because years is not mentioned anywhere here. Okay, it's not mentioned. So you can write just 30. Answer is 30. Okay, so the 11th one, not 30 years guys, it is just 30 because already age is asking as well as years is not mentioned anywhere. So you can write 30. Okay, then 11th one, what is the absolute dose of PPS in a day? What is absolute dose of PPS in a day? Very easy question, right? So answer is from text D and 300 mg, that should be the correct answer. Okay, 300 mg. Okay, Tessie, very good. It's a very simple question, right? 300 mg. Okay, Ammo, 300 mg. Okay, Sarala. Okay, Vidya, 300. Very good. Okay, Reba, it is 300. Yes. Okay, Radin, 300. Okay, so now the next one, 12th one. The medication that are prescribed to treat infections are called dash. So what is the name of this medication? Okay, infection. You are taking this medication to treat the infection. So what are the medications? Okay, which medicine is using? We are using, okay, antibiotics to treat infection, which is from text B, and you are using antibiotics to treat the infections. Okay, so even though it is a direct answer, but still, if you are not reading it properly, it will be very difficult for you to articulate or locate that particular answer from the text. Okay, so it is antibiotics. Okay, so the next one, 13th. What is the prevalence of women and AFAB in the United States towards interstitial cystitis? So my keywords AFAB as well as United States. So where they've mentioned about the prevalence? Okay, so that is from text A. And what is the prevalence here? It is 3 to 8 million. Okay, so that is 3 to 8 million. So answer should be 3 to 8 million. Okay, Reshma, see, if it is approximately 3 to 8 million, it is quite a lengthier answer. So you don't have to write that approximately there. So instead of that, you can write 3 to 8 million. That's enough. Clear? Yeah. Okay, 3 to 8 million. Okay, Varsha, it is 3 to 8 million. Okay, so the last one, 14th one, the methodology, the procedure encountered, used by the patients with IC or BPS during January 2020 till and May 2021. So what is the correct answer? Which procedure we are using? What is the procedure? Okay, which procedure? Any idea? 14th one, which procedure we are using for that? It is hydrodistension. Very good. It is from text C. We are using the procedure hydrodistension. Okay, that is from this particular box in text C. Patients with IC or BPS who underwent, encountered, which means it is underwent. Okay, that is hydrodistension. Very good. Okay, let's see, Reba, it is hydrodistension. Then we are jumping to the next set of questions, 15th one. Among the 387 people scrutinized for downstream analysis, 29 of them is categorized into dash. Okay, categorized into what? Okay, so answer should be, they are categorized into, it is from text C. Okay, so they are categorized into anti-thrombotic group. Okay, yes, answer should be anti-thrombotic group from text C. So patients are 387, so which they are categorized into anti-thrombotic group. Very good. Yes, seen it? Okay, Reba, Tessie, it is anti-thrombotic group. Okay, so 16th one. You may requisite anesthesia, which means require anesthesia, to undergoing cystoscopy if the contributor required to have it along with dash. Along with what? Along with something. Okay, and something. So what is it? What is it? Along with what? Okay, so that should be, any idea? Bladder biopsy. Very good. It should be bladder biopsy. So, however, if your provider orders a bladder biopsy along with cystoscopy, okay, it may require, so requisite anesthesia. So, answer is bladder biopsy from text B. Okay, then 17th one. The causes of interstitial cystitis may include autoimmune diseases, dash and tissues with your bladder lining. Again, direct answer. Okay, bladder lining causes, then autoimmune. So what is the correct answer here? 17th one. Okay, so that answer should be allergies. Okay, diseases mentioned, autoimmune diseases mentioned in the question, issues mentioned in the question. Okay, answer is allergies from text A. Okay, Reba. Yes, allergies. Okay, Reba, Lijo. Okay, Vidya, Reshma, Tessie, Ammu, Retin, Anu. It is allergies. Very good. Allergies. Excellent, Varsha. It is allergies. Okay. Then, second last one. Sorry, 18th one. In biopsy, a needle is used to take tissue sample of your bladder wall and dash to rule out other conditions including bladder cancer. So, what we are using here? Other than the needle, what we are using? Okay, so it is from the procedure. So we are using something. Okay, so where is it mentioned that it is urethra? So you got that answer from text B, right? Okay, so where is it mentioned? Okay, see, then use a thin needle to take a tissue sample of your bladder wall and urethra. So that is along with, you can use a urethra. Okay, so that is mentioned here. Answer is urethra from text B. Very good. Okay, Radin, it is urethra. Okay, Tessie, Reshma, Zenith, Varsha, Ammu, Anu, yes. Okay, Vidya, urethra. Then, 19th one. Hydroxine, which belongs to the class of dash, are given to the dose of 10 to 7 mg daily. Okay, class of what? Belongs to which medicine class? Okay, so that belongs to antihistamines. So which class? See, it belongs to antihistamine. Okay, so answer should be antihistamine. Okay. Okay, Riba, Seenath, Anu, it is antihistamine. Very good. So what about the final question? 20. Question number 20. Interstitial cystitis is a condition that causes long-term pain or discomfort in your bladder and dash along with urinary frequency and urgency. So what is the correct answer here? Everything which is mentioned in text A. So that is from, okay, here. Interstitial cystitis or bladder pain syndrome is a condition that causes long-term pain or discomfort in your bladder and abdominal area. So answer should be abdominal area. Okay, okay, Varsha. Okay, Anu, it is abdominal area. Very good. Okay, Radin, Tessie, Seenath, Reshma, Reba, Vidya. Okay, okay, Reba, Rijo, Reshma, abdominal area. Okay, so anyone with 20 out of 20? May I know in the comments? Anyone with 20 out of 20? Okay, Reba, excellent, dear. Very good. Good enough. 20 out of 20. Anyone else? Anyone else with 20 out of 20? Okay, okay, Ammu. I'm so happy to hear that. 20 out of 20 within 11 minutes. Excellent. So happy for that. Okay, Seenath, 20. Okay, Redin, 20. Okay. So trust me, you guys are gonna clear part A within 15 minutes and you will score 20 out of 20. Okay, so God bless you all. Thank you. Stay tuned. Same time tomorrow.